If you or a loved one has faced a cancer diagnosis, you've likely spent countless hours searching for every possible advantage. It only makes sense. And that search often leads to the world of complementary and alternative medicine, or CAM. The promise of a natural, less toxic path is incredibly compelling. But what if that path, when chosen incorrectly, is actually putting you at a far greater risk? Hello, and welcome to Elevating Cancer Treatment, where we dissect the science, explain it, go through the details, debunk myths, and help you navigate your health journey. If that sounds interesting, like this video, subscribe to the channel, and hit the notification bell so that you never miss an update. And please share it if you find it useful. I'm Dr. Jay Chaplin. An important reminder, I'm a PhD, not an MD. The information in this video is education and not medical advice. Every cancer is unique, and no general information applies to everyone. Now, two quick things. First, as a thank you for being here, I've created a free resource, 10 things to elevate your chemo journey. You'll also get updates on the innovative new cancer treatment I'm working on. So please take a moment, download your free guide from the link below, and join us in shaping the future of cancer treatment. So today we're going to break down two critical studies that analyze the outcomes of nearly 2 million cancer patients. The data is really clear, and the findings are, frankly, disturbing. This isn't about shaming anyone. It's about giving you the evidence you need to make the best, most informed, and most effective decisions for your health. It's definitely something to consider when you're thinking about what cancer care to get, what to refuse, how to weigh those things, and how complementary or alternative medicine really stacks up. While there are a couple of significant limitations to these papers, they are, in general, really, really well done. And they look at well-matched clinical data and with a large sample size. This is about as good as it gets. As always, we've linked the full studies down below in the description. Okay. One of the larger issues with complementary medicine is that because there are so very many different approaches, even down to fine points of style, and people will argue over what's the right one, what's the wrong one, it is incredibly hard to do well-designed and well-controlled clinical studies for them. There's very little real evidence for or against most types. There's an absence of evidence, but you could argue that. So it's nearly impossible to run a clean, controlled, and large enough clinical trial for every single modality. What we do know is that a few of those have been proven to be helpful. We've talked about a couple of those already, and several are definitely harmful. And most have so many factors to consider that it's unlikely that we'll ever have any real data about them. We've already covered several of these in different categories, and we'll do more episodes on specific CAM treatments in the future. What these two studies did was to lump together all non-conventional treatment as CAM and analyze the outcomes. This loses a lot of detail we'd love to have about specific treatments, but it gives us a very solid overall readout. And that result isn't good, but it's really interesting. And it moves us from that absence of evidence and evidence of absence for any beneficial effect. So the first study looked at partials. These are folks who did any complementary medicine along with any conventional treatment. And they looked at people who chose CAM alongside conventional, whether people taking that CAM refused some of the conventional treatments. They looked at overall outcomes, they looked at who chose CAM, and they compared all of these. So these 1.9 million patients were diagnosed with either breast, lung, or colorectal cancer. They were followed for over a 10-year span, and they were matched for age, cancer status, overall health score, insurance type, race, and cancer type. Pretty well controlled overall, though it could have been a little more carefully controlled for obesity and metabolic diseases because we know those are factors. So when comparing the outcomes between those who used any type of complementary medicine and those who used no complementary medicine, those who chose complementary medicine were twice as likely to die within 5 years. Think about that, twice as likely to die in 5 years. That's a really big and really negative effect. And it would be really good to know why that's happening. Fortunately, the authors dug deeper. It turns out that many of the people who chose complementary medicine also refused some or all of the conventional treatments. On average, the refusal rate for chemotherapy, hormone therapy, or radiation was between 30 to 50% higher for those who chose CAM. They substituted complementary medicine for conventional. That refusal, the decision to skip a proven treatment, makes a massive difference. After taking that factor out by comparing people who used CAM to those who didn't, but only for those who did all of the recommended conventional treatments, so these are people who did CAM on top of conventional, a lot of that difference disappeared, about 2/3. Now, while the difference wasn't statistically significant anymore, so we can't say for certain that CAM by itself caused worse outcomes, there was still a definite and noticeable clinical impact, as those who used CAM at all, in addition to conventional medicine, so on top of it, still had a 39% worse overall survival rate. This is a key distinction. The statistics show the association is no longer certain, but the clinical impact is very clearly negative. It suggests that while refusal of care is the biggest factor, the inclusion of some CAM modalities may still be actively detrimental, and we know that for a few of them, so that makes sense. That's even when you're doing everything else right. Okay, so what about the most extreme cases? We're talking about the patients who chose alternative medicine, CAM medicine, instead of conventional. They forego all of it. It's CAM or conventional, no overlap. The ones who went all in on an alternative path, in those cases, the effects were significantly worse. Overall, the risk of death over that 5-year span was 2.5 times higher in the CAM-only group, but for specific cancers, the numbers were astounding. For colorectal cancer, the risk was 4.5 times higher of death, and for breast cancer, it was a staggering 5.5 times higher. This is not a small risk. It is a profound and life-threatening choice that's often presented as in your benefit, but clearly is not. Now, these studies also revealed a fascinating bias in who chooses CAM. These patients tended to be younger, more affluent, more educated, and women. And ironically, they often had a worse disease status or a higher clinical stage, higher clinical score. These are the people who have the resources to pursue alternative treatments and the energy to share their positive stories online. This creates a bias in the real world, making CAM seem more effective than it is because these people are putting their information out there while they feel they're making a good decision, and then they disappear to not give a negative one. Plus, there's a reporting bias. Many patients don't tell their doctors about the CAM that they are using. This means that the negative effects that we've discussed from these papers are likely even higher than the numbers suggest, because the conventional-only control group is probably already contaminated with unreported CAM users. So this is probably already higher, and over here, that's going to make it even higher than a true baseline. Again, the last thing we want to do is to cause stress by steering you away from approaches that you would feel incomplete without taking. We want you to feel good about your treatment choices. While a few CAM modalities are actually very dangerous and proven dangerous, most aren't harmful, and we are breaking all of those down in different episodes here. The core message from this massive body of evidence is clear and undeniable. Relying on complementary or alternative medicine instead of conventional treatment puts you at risk of a far greater life-ending outcome. Please, if you are going to use alternative medicine, do it in addition to conventional treatment and not as a replacement. Beyond these videos, if you need more personalized guidance or a deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions and medical advocacy. You can find information on both of these resources on our website, again, linked down below. If you found this video informative, please give it a thumbs up, subscribe to our channel, click the notification bell, and that way you'll get more science-based cancer insights. What are your perspectives on complementary and alternative medicine? What have you seen? I know that there are many different treatments with many strong proponents who think that it is the greatest thing in the world, that it saved them. I'll be doing an episode soon about how to think about those, because there are quite a lot of those comments and they may not mean what you think they mean. But for the moment, is there anything that you want to know about complementary and alternative medicine? Please put it in the comments down below and help guide us to what's the most useful for all of you.